Hello, my name is Michael J. Connolly. I'm the therapist and also the president of Positive Pathways. This is an outpatient clinic in Pittsburgh, Pennsylvania. I have what's called an LPC. I'm a licensed professional counselor. Also an NCC, which is a National Certified Counselor. I've also just recently received my NCGC. That's a National Certified Gambling Counselor. Actually, the reason I did that is there's a casino opening, in fact, just in 2 weeks here in Pittsburgh, and they're short on people that are familiar with what's called pathological gambling. But my true passion is with OCD. I have personal reasons for that. I have a family member that suffered with OCD, so it's something even before I went back to school to study. It's something that I took a very special interest in. And as far as OCD exposure therapy, as far as I know, there is no certification, there's no schooling out there to teach exposure therapy. It's kind of trial by fire. I've learned exposure therapy through other therapists in Pittsburgh, working one-on-one with them. I use exposure therapy in my practice with clients suffering with obsessive compulsive disorder. I've been very successful with many clients, as long as they're willing to work with me. That's what's most important. Is it's not just what I do. It's the willingness of the client as well. Exposure therapy, unfortunately, you're asking someone to face their fears, to face their anxiety, and you're asking them to do that on a consistent basis. So at times, some people do, leave therapy because it is very uncomfortable. But the individuals that stay in therapy, the individuals that embrace and understand exposure therapy, are the individuals that do usually get better. Obsessive compulsive is a neurobiological disorder, so medication plays a huge role as well in treating obsessive compulsive disorder. But the combination of having the pharmaceutical psychotropic medication for obsessive compulsive disorder, but also the exposure therapy along with response prevention, the two together is really a formula for great success, and I've been fortunate enough to see that on my end as a OCD therapist with the clients that I've worked with. Okay. Today I'll be working with a female client, 36 years old. I've been seeing this young woman for about a month and a half. Her OCD is manifest in a way where she has a fear of driving her car, that she every time she hits a pothole or a bump in the road or feels any type of bump in the road, that's a trigger for her, and her OCD mind, the irrational thoughts, tell her that she's hit somebody. So her compulsion then is to turn around and go back and check. This is very common. It's actually a very common OCD phenomenon that I've seen probably 3 or 4 times in my practice. The best way to treat this with exposure therapy is actually driving with the client. We could talk about this in the office to a certain point, but eventually we have to face the trigger in person together. So what we're going to do today is actually, she's unable to drive. That's how severe this OCD has gotten. So we're going to drive in my car, which is behind me. I'm going to do a little bit of driving, and then I'm going to ask her to do some driving. And we're going to monitor her anxiety levels using a 1 through 10, 10 being the highest level, and 1 being the lowest, obviously. And we're going to use exposure therapy, and we're going to film as best we can. My girlfriend's going to help us out, and the client has agreed she's a little nervous about being on camera, but she's agreed to allow us to do this. And actually, I do use videotape a lot of times with clients for certain compulsions and obsessions. It comes in handy a lot of times. So I'm going to shut the camera off now, and I'm waiting for her. She should be here in about 10 or 15 minutes, and we'll start from there. I got to watch my too. Damn it, I'm saying it again. Today I'll be working with a young female client, 36 years old. Problem with her, she has OCD and the fear of driving her car. She fears that when she's driving her car that she's hit somebody, and she hits a pothole in the road. Damn it. She has a fear if she's hit somebody in the road. Damn it. Let me just keep this filming. Today I'll be working with. You're able to listen to music because you said that was one of your fears. Is you can't enjoy driving. And part of enjoying driving is listening to music. Not necessarily texting or talking on the phone, but listening to music is enjoyable while we drive.
Mike, I think you might have just hit somebody. Can we check?
As far as Michael Jackson, what is your favorite Michael Jackson song?
I think can we pull over?
Mine is "Want to Be Starting Something." You want to hear it?
Can you no? Can
we put that on here?
Mike, can we please check? I think he ran somebody over.
Steph, it's not that I'm being rude. I hear what you're saying, but we've talked about this. What you're asking me for is reassurance.
I need it.
I realize that, but if I give you the reassurance, I'm doing a disservice to you. I'm just enabling your OCD. I'm just feeding your OCD. So,
can we just pull over and check?
Today, I would really like to continue driving. Okay, and this is exposure therapy, and this is what we talked about. And I know maybe I seem that I'm being harsh or cold or mean, but I'm not. It's, this is treatment, and this eventually, as we do this more and more, and we're going to do this more and more.
But if we could just check one time and then maybe try.
I'm going to continue driving.
But there's people everywhere.
Sorry about that. There are. There's people in the park. There's people. But we're on the road. I'm falling. I'm doing the speed limit. See, what I'm even doing right now is I'm giving you reassurance, and that's what I don't want to do. Okay. I want you to talk about your anxiety. We're continuing driving, and maybe we did run somebody over.
But
if that's the case, well, I'm sure they'll get my license plate and I'll be arrested. And if it is, then I ran somebody over. Now, what I'm doing right now is I'm giving you some reassurance because I see how anxious you are. But the fact is, we've been driving now for, a half an hour, and you started, and your anxiety was at a 10, and your anxiety was at a 5 when we pulled over. Now, where's your anxiety now?
It's at a 5 still.
Okay, that's great. So we went from when we started from an 8 or a 9 down to a 5. You got the irrational thought that I ran somebody over, yet we're continuing to drive, and your anxiety is still at a 5. Okay.
Mm-hmm.
So the more that we do this, the more that we drive, and then eventually the more that you drive. And with me driving with you, and then eventually you driving by yourself. And that's our ultimate goal, is to have you driving by yourself comfortably without checking. And the thought might pop up from here or there, but I want you to use some of that cognitive behavioral therapy that we talked about. That's that inner dialogue. And it's okay to reassure yourself at times to say, no, this is my OCD. This is an irrational thought. Yesterday, we worked with exposure therapy. Driving in the car, your anxiety level was, we started out and the anxiety was an 8, and eventually it came down to a 5, which is great. It's wonderful. Eventually, we want to get to the point where you're driving the car rather than me driving the car. And it's important. Eventually, my goal is to get you driving your own car. Okay. Specifically, I can't do it. Now you're saying, I don't think I can do it. So you hear the difference? There's a little difference between I can't do it and I don't think I can do it.
Right.
To me, that sounds like a little more hopeful than we were.
Do you think I can do it?
I absolutely do think you can do it. I know you're saying that I love. Our minds are like bad neighborhoods. Never go in there alone. It's a dangerous place to go into our minds alone. And it doesn't necessarily mean go to a therapist or a counselor professional, but when you're dealing with anxiety, when you're dealing with thoughts that are bothersome, share it with somebody, a good friend, a parent, a significant other.